Good morning or good afternoon to everyone wherever you are joining from today. Welcome to today's webinar, Eliminating Sugary Drinks in a Large Health System, Leveraging Data for Systems Change. This is the second of a four-part series sponsored by the American Cancer Society and the Public Health Law Center on creating healthier food and beverage environments in hospitals and healthcare settings, with a particular focus on addressing sugary drinks. My name is Craig Massetti, and I'm a policy analyst at the Public Health Law Center. For those who don't know us, the Public Health Law Center is located in St. Paul, Minnesota at the Mitchell-Hamlin School of Law, which is located on the traditional homelands of the Dakota. As a team of attorneys and policy analysts, we work nationwide to help communities develop policies and laws that will be grounded in community, evidence, and solid legal principles, and particularly focus our work on public health policies to prevent and reduce chronic diseases and promote health equity. On the point of promoting health equity, this is core to what we do at the center. This means that we are committed to partnering with communities and organizations to use the power of law and policy in a way that addresses the social determinants of health and meets the specific needs of all communities, especially those who unfairly bear a greater burden of health challenges and other social harms. It is through this health equity lens that we work to address commercial tobacco and promote healthy eating and active living. And it's why we are working specifically on addressing sugary drinks. Over the past several years, there's been a growing movement of hospitals and health systems in the US that have stopped selling sugary drinks or reduced their availability in favor of healthier alternatives. Adding to this movement has been calls from the American Medical Association, American Heart Association, and American Academy of Pediatrics for hospitals to model healthy food and beverage environments, including by implementing policies to limit or disincentivize the purchase of sugary drinks. Our work with ACS has been to help healthcare organizations answer this call. And I want to take this opportunity to particularly recognize Kristen Sullivan, who's the Director of Nutrition and Physical Activity at the American Cancer Society, who's been a really wonderful and valuable partner in this work. Earlier this year, we released a Healthy Healthcare Toolkit, which is a suite of educational and technical tools designed to help healthcare organizations or other employers develop and implement a healthy beverage policy or initiative. You can find more information about this project and the full toolkit on our website. For today's webinar, it's all about learning from others that have taken on this issue. And one of those organizations that's been at the forefront is the University of California at San Francisco. Today, we'll hear from two experts, Drs. Laura Schmidt and Alyssa Epple, who were involved in the development and implementation and evaluation of the UCSF Healthy Beverage Initiative, and how they are using this experience to catalyze broader change. Dr. Schmidt is a professor of health policy in the School of Medicine at UCSF. She holds a joint appointment in the Philip R. Lee Institute of Health Policy Studies and the Department of Anthropology, History, and Social Medicine. She is also the co-director of the Community Engagement and Health Policy Program at UCSF's Clinical and Translational Sciences Institute. Dr. Schmidt's central goal is to bridge the world of biomedical research, clinical practice, and population health, and has focused her research in the areas of addiction, poverty, and obesity-related metabolic disease. Her work has been funded through awards from NIH, the U.S. Substance Abuse and Mental Health Services Administration, and a variety of private foundations, including the Arnold Foundation, the Robert Wood Johnson Foundation, Commonwealth Fund, and others. Dr. Epple is a professor and vice chair in the Department of Psychiatry at UCSF. She's also the director of the Aging, Metabolism, and Emotions Center and the Consortium for Obesity Assessment, Study, and Treatment, and associate director of the Center for Health and Community. Her research aims to elucidate the mechanisms of healthy aging and to apply this basic science to scalable interventions that reach vulnerable populations, and is particularly focused on the intersections of stress, addiction, eating, and metabolic health. She co-leads several NIH-funded studies and for 10 years led University of California Office of the President Multi-Campus Center on Obesity. She's the president of the Academy of Behavioral Medicine Research and co-leads the UCSF Task Force on Climate Crisis and Mental Health. Her work has been featured in outlets like TED-Med, the Embassy's Today Show, 60 Minutes, NPR, the New York Times, and other outlets. And she's also co-author of the New York Times bestseller, The Telomere Effect, which came out in 2017. So with that, I will turn it over to you, Dr. Schmidt, to kick us off. And once again, thank you both for joining us today.
Thank you so much, Craig. We're so happy to be here and to talk to our amazing colleagues who helped pave the way for this work.
Thanks, everybody. I'm going to get us started, and then Alyssa and I will play a little bit of tag team here. We want to share a little bit about the experience at UCSF with our Healthy Beverage Initiative. Then Alyssa is going to share some of the findings from our research on that effort. And then I'll conclude with a little wrapping up on what has become an international movement to make healthcare more healthy and sustainable through food environment interventions, including healthy beverage initiatives. So to start off, I'm just trying to figure out how to, there we go. This idea of a sales ban is a fairly new idea for private sector policymaking on obesity and chronic disease prevention. So we have plenty of public sector strategies such as soda taxes, warning labels, front of package labeling to help the public eat a more nutritious diet and avoid unhealthy products in our food supply. The sales ban represents a private sector policy, which may from a political standpoint be an easier, lighter lift for institutions than going to battle with industry around public sector policies such as soda taxes. It's really important to emphasize that a ban on sales is not a ban on use. So the concept of a healthy beverage initiative is an institution's decision to stop selling sugar sweetened beverages or other unhealthy food products. It is not a ban on people in that institution using those products, whether in the workplace or at home. And I'll share a little bit more about how important that is and has been in our experience at UCSF. Why SSBs? This is always the question people ask. And there are now 2 meta-analyses out there in the literature that show that sugar consumed through liquid sugar products like SSBs actually lead to greater metabolic disease risk than equivalent amounts of sugar in foods. And the other really important, Craig mentioned the center's deep felt commitment to health equity. And one of the really important aspects of working in this space is to acknowledge the health inequities in availability and marketing, pressured marketing, target marketing, and consumption of SSBs in lower income communities and communities of color. So everything we do in this space needs to be driven by an ethic of health equity. In 2015, the University of California decided to stop selling sugar sweetened beverages. It took us about a year or two to build a stakeholder movement within our university about that, and all to come to an agreement that we would voluntarily stop selling sugar sweetened beverages throughout vending machines, cafeterias, all of our food courts and food truck areas on our campuses, all retail locations, hospital menus, catering services, and so forth. So we made a commitment to health by deciding to stop selling sugar-sweetened beverages throughout all venues. UCSF is a rather large institution. It's the largest, other than the city government, it's the largest employer in San Francisco, about 28,000 employees, many students, patients, and families come to our campus venues. Here's just an example. We have, our vendors include a range. We have here a farmer's market. Sorry about that. We have a farmer's market on our campus. We have all sorts of food trucks, mom and pop shops. We've got some franchise food venues, and all of them decided to stop selling sugar-sweetened beverages. Here are the beverages that are acceptable under our Healthy Beverage Initiative. People may be familiar with Smart Choices, and we essentially made the Smart Choices the ones that we would sell, and provide some alternatives that are less healthy, such as diet sodas are within our policy, but no sugar-sweetened beverages. One thing I want to emphasize is that leading up to this, we really worked with our vendors directly, one-on-one, to make this transition, supporting them through all manner of materials such as this to put out. Notice that we gave a healthy beverage website. We didn't want our vendors to have to be in the position of explaining the policy or taking any heat for it from consumers. We wanted it to work for them. And so we asked them to direct any concerns or questions from their patrons to a website, and the team behind the Healthy Beverage Initiative handled those issues. I just wanted to briefly mention some of the things we learned along the way in our implementation, and during the Q&A, I'm happy to talk more about this. Our chancellor, we had at UCSF a challenging experience around our smoke-free initiative. We don't allow any form of smoking anywhere on our campuses. And that had been a real top-down mandate where the chancellor said no more smoking. And it turned out to be a real challenge for us to implement. And so learning from that, her position at the time was that if we were going to do this, it needed to be voluntary. And that really upped the stakes for the team of us that was working on this. And so we wound up using strategies from stakeholder engagement to work. We did both a top-down and a bottom-up approach. The top-down meant that we got leadership's approval of the policy before we started down the path of working with stakeholders on the ground. So that included the CEO and CMO of our medical center, as well as the chancellor's office and other top leaders on our campus. And then the bottom-up approach was to work with students, faculty, and staff, as well as our vendors in all of our campus constituencies to build support around this initiative. It was time-consuming, but it really paid off in terms of implementation, because once you build a robust coalition of stakeholders that really believe in an initiative, it turns out that implementation is a lot easier. We have had very few violations or problems with implementing the initiative as a result of that in the years since 2015 when we implemented. We emphasized, and this is important for all health organizations, to really view this initiative as mission-driven, as consistent with our mission, that if we're all about health and our own scientists are telling us that excess sugar is a cause of cardiometabolic disease, cancers, heart disease, that the very things that we treat in our hospitals, that it is upon us to walk the talk and to model. And I would say we conducted some opinion surveys with our hospital staff and students and faculty, and we won't have time to share a lot of that information, but we really found, both anecdotally and through our surveys, we had about 80% of our campus stakeholders, our employees, that supported or were neutral on this idea of taking the SSBs out of our institution. And many of our doctors and dentists and people who treat sugar-driven health problems were grateful. Nursing, dentistry, were grateful because it had proven very challenging for them to be treating patients, telling patients to not consume SSBs, and then those patients and their families would walk out into our food court where they were abundant. And so it really supported the health mission of our institution to take this step. And I really want to underscore that. We did use social marketing techniques. We'll share a link at the end to the Sugar Science marketing materials, which are free and downloadable for anybody who wants to use them. We really drove the messaging here around what I call the personal choice pothole. Why are you telling me what to eat? The answer to that in the context of a healthy beverage initiative is nobody's telling you what to eat or drink. We as an institution that stands up for health, are making the decision in our procurement policy. But we are not telling anybody not to bring SSBs in, put a 6-pack in the fridge at work, drink as much as you want. This is a decision our institution is making because it's consistent with our mission to promote health. It's the right thing to do. And at the time, back in 2015, there were very few role models that we could find for an initiative like this, and there was no data out in the literature to support that it could work. So you can imagine how challenging it is to talk to, say, a CFO who's really worried about the bottom line, and I had this very experience, and is worried about the messaging around personal choice, and you're recommending something that is untried. Fortunately, that's not the case anymore, but in 2015 it was. And so we got help where we could, and we were really lucky and happy to find that the medical center at the University of Michigan had already done this, not their whole campus, but the medical center had, and they were really supportive and helpful in working with us to figure out an implementation strategy. And so we are paying forward by trying to do that with you as well as others in the health sector. We also leveraged off of evidence at the time that was abundant on smoke-free workplaces, indoor air issues, and so that the tobacco experience was very beneficial in at least giving us the hope that something like this could actually affect consumption and drive down cardiometabolic disease risk. And because there was no research on this topic, we decided at the very outset to build an evaluation into our initiative. And we were very, very fortunate to have the support of our campus leadership, our medical center CEO, and our provost and our dean of medicine all chipped in to support the evaluation. Alyssa and I worked as volunteers on that project. We all did it out of the hope and prayer that this would be a strategy that would work. And it was for me a real thrill to team up with Alyssa. I'm a public health researcher and sociologist. Alyssa does clinical trials and collects blood samples and does very different kind of science than I do. And we had some disciplinary, respectful disagreements. She was a little skeptical about whether just taking SSBs out of the food environment would make a difference. I kept insisting it would, based on what we knew from tobacco and alcohol. And Alyssa felt it was very important to build in a brief counseling intervention, a clinical approach. And we will share, I'm going to turn it over to her, and we will share a little bit of what we learned from both research efforts.
Thank you so much, Laura. It's been
I didn't get that. Could you try again?
You can hold your questions, whoever that was, just kidding. So it's been an honor. It's been one of the highlights of my career to collaborate with you, Laura. You've been so foundational in the impact of your work, and I've learned a lot from you. So I'm going to get to present the results of our trial to you all and tell you about our new, bigger controlled trial and early results of that. So what we scrambled. I also want to acknowledge we got some funding, from small pots of funding put together. You can do anything. So we had, some help from RWJ as well as UCOP. We employed in a very short period a survey of over 2,000 UCSF employees, and made sure to weight it toward our service workers and our employees of lower socioeconomic status, since we knew they were heavier drinkers. We followed our UCSF cohort for 1 year, and we were able to do both a 6-month and a 12-month assessment, looking at how much people drank using the standardized BevQ, a self-report questionnaire. We also embedded in this study an examination of heavy drinkers. So for the first 214 people that were drinking at least 1 SSB a day, we recruited them into a metabolic health study. This was also with our colleague Rob Lustig, who is on the call with us today. We assessed their body mass index and their abdominal adiposity with waist circumference and a few other methods. We also took a fasting blood draw before and after the ban. So I'm going to report the results from that sub-study today. This was public. So this slide was a paper we're working on now. So here's an early peek. And we've been very interested in who is benefiting. And what you can see here is at baseline, our service workers, maintenance, employee, police, cafeteria workers, shuttle drivers, were drinking around 30 ounces a day, much more than any other groups. And you can see there's almost minimal to no drinking in our faculty, in our physicians. Next slide. And similarly, that is the pattern of reduction we saw. Thank goodness. What we found was that this had an extremely differential benefit on our service workers. So you can see here that on average, in this huge sample, we saw the biggest reductions in our service workers, around 8 ounces a day reduction just from the removal from the environment. Next slide. Okay, so I'd like to focus on our heavy drinkers now. So this is our subsample we followed very closely. And we registered our hypothesis in clinical trials. And this probably doesn't surprise any of you, but our primary outcome was not BMI. Our primary outcome was abdominal fat. And that is because there are specific metabolic pathways that regulate total fat and abdominal fat. And we know that abdominal fat is a sensitive tissue to liquid sugar and to stress, and it is much more highly metabolically regulated. It's the first to change when people lose weight. And we know from a very controlled study that Rob Lustig did that when you take children off sugar, they're eating the same amount of calories, but they're having a sugar-free diet for 10 days. You reduce visceral fat 7%, no effect on BMI. So it's it's the first tissue to change. We also, yes, next slide. So let me show you what we found. In terms of SSBs in our heavy drinkers, we found a reduction of 17 ounces 10 months later. So this is a reduction of almost 50% of how much they were drinking just from taking it out of their workplace. In terms of BMI, no change. And we did find significant reductions across the sample, whether they were lean or obese, in both waist and sagittal diameter. So this is what we hoped for. Of course, we hoped that they would lose weight too, but they're about 68% of the sample lost waist girth, and most of those also lost weight. Next slide. When we looked at our lean and our overweight and obese samples, we found differential impact. So we found a significant but small effect on our lean employees, around 6 ounces reduction per day. And for our heavier sample, we found almost 20 ounces reduction per day. And similarly, in our heavier sample, we found a reduction of 2.6 centimeters for their waist girth. So this is clinically meaningful. We also looked at correlations between how much they drank and whether that improved their insulin resistance. And we found that the more they decreased in SSBs, the better their HOMA, the more insulin sensitive they became, and the more their cholesterol was reduced. So that was a good proof of concept for us, that it was dose response. It wasn't just a self-report effect that they wanted to please us and say that they were drinking less. This slide just shows you that indeed over the full year, we saw a maintenance of SSB intake. So this happened early. Within 6 months, we saw benefits, and this was maintained at 12 months. And what you see here is that this was modest benefits for the lean sample, but for the overweight and obese sample, you see a pretty dramatic decrease in the first 6 months that was maintained. Next slide. Okay, so this gets to the fabulous debates Laura and I had before we started. And I have a history of working in an eating disorders clinic when I was in training decades ago with Kelly Brunell and working with people with food addiction, binge eating disorder, and have seen, as many as of us have seen, the tragedy of when you cannot change your behavior and when it's impacting your health and your quality of life. And so I really didn't believe that our daily soda drinkers would be able to change. I thought that they would override the sales ban, that they would be taking soda in from home to the workplace, and that they would need more. So Laura and I agreed on a nested trial. We implemented a randomized trial within our environmental sales ban, and half of our heavy drinkers were randomized to a brief motivational interviewing intervention. This slide here just shows you that we're really fighting some extremely powerful neurobiology when we think about getting someone to stop eating sugared foods or sugared beverages. So we know that just daily stressors can trigger us to have more cravings. And we know very well how this works in terms of the neuroscience of animal studies, that stress can increase the sensitivity of the reward center, and that over time this creates a habit. So whether you're stressed or not, you're then have a dependence and a hedonic withdrawal when you're not having the sugared beverage. So based on this, we measured how much they drank at home and how much they drank at work. And what we found is that they reduced how much they drank both at home and work. They didn't overcome the sales ban by bringing in soda, as far as we could tell. Now, when we looked at those who received the extra boost, the higher touch intervention, which was about a 10-minute conversation with a health educator trained in motivational interviewing and some follow-up phone calls. It's very detailed in our appendix if people are interested in our motivational intervention. So what you can see here is it had a little, very little effect on our lean sample, but on our heavier sample, this had the most dramatic effect. So they were drinking 10 ounces less just with the sales ban, and almost 3 times less if they had the brief touch of someone talking to them about their health, showing them just sugar cubes that they were drinking each day, visually asking them what they care about most. Next slide. So in summary, the sales ban alone led to an overall reduction across the sample of heavy drinkers of 17 ounces a day, for, again, across the sample, a reduction in abdominal fat. This is a very meaningful metabolic marker. And the more they reduced, the better the improvements in insulin sensitivity, the fasting insulin and glucose ratio, as well as their total cholesterol. And we found that these effects were, it was a social equity, and health equity intervention in a sense, because these changes helped our lower income workers and our heavier sample the most. Next slide. Okay, so that was a proof of concept study. We were very excited to see these visible effects. And Of course, a huge limitation is we didn't have a control sample. So we have partnered with Jamie Schmidt and colleagues at Sutter Hospital System in Northern California. And we have an ongoing trial in 8 hospitals in the field. So we have about 700 participants, healthcare employees. Half of them are working in hospitals where we've implemented a healthy beverage initiative. There's a sales ban. And in the other half are in control hospitals where they can still buy sugared beverages. And we used a similar design. So we're assessing intake as well as dietary intake, BMI, and abdominal adiposity at baseline 6 months and 12 months. I can tell you that we have looked at 4 hospital systems so far, and we are seeing really promising effects of just the sales ban alone. So we're extremely excited. Something is happening now. We're close to finishing the study, and we are in a pandemic, and we have a large hospital healthcare cohort who is now under tremendous stress. So there's a shelter in place period, and most of them have returned to their workplaces. So we are at the verge of an amazing opportunity to look at, can a sales ban help them maintain their health during this incredibly stressful period? Many of you have heard of the COVID-15. So instead of the freshman 15, people are gaining weight. And it's not just that they're sitting at home. There's a tremendously strong literature between emotional stress and overconsumption of calories, but not any calories, sugar, comfort food, and SSBs. So we hope, pending funding, to follow the cohort for the next year to both look at pandemic stress, metabolic health, and SSB intake, but also if we can buffer that effect with our sales ban. So we're very excited to move forward on this. I'd like to move to our next 2 studies, and I'm going to have Laura tell you about them, but I want to just take a moment for all of us to acknowledge what's happening in the world. We are in Northern California. We have 500 fires. We knew this was coming. No one should be surprised. Everything we do is connected and related. And so we have been partnering with amazing colleagues to look at the carbon imprint of our Healthy Beverage Initiative. We have David Cleveland with us today on this call, who's been devoted to this work. And we've also looked at the cost savings. And I just want to say that you all, with the roles you have in healthcare, in hospital, systemic change, have such an amazing opportunity for change, for these huge levers you can pull. I first started doing this work influenced by my mentor, who's also on the call, Kelly Brownell, decades ago, pointed me to this idea of optimal defaults. We can try to change individuals, but when we make the easy choice in the environment, the healthy choice, all of a sudden we have public health change. And in terms of contributing to carbon pollution, we have the we have these soda cans, we have these plastic bottles, and of course the huge amount that our medical institutions, our healthcare costs create on our carbon pollution. So I can't leave my home because of smoke. This is our new normal. This is going to happen again and again, and it's going to be more frequent. And I just want to say that the more we can see the connections, the co-benefits of things like changing our food system, changing something as simple as SSB, we are making an impact on our environment as well as our physical health. So I will now turn it to Laura. I'm sorry to have a burst of emotion, but it's real and we all need to acknowledge it, whether we see it yet or not. Let California burning be a beacon to those who do not see the climate crisis and how it's tied into our food and our healthcare. Thank you.
Thank you, Alyssa. I'm going to finish up the research part and talk a bit about dissemination, and then I'm really interested in hearing people's views and questions. We have 2 other studies that I just want to point your attention to, and Craig and his colleagues will be sending you PDFs of these publications They're all out in the ones that we'll be describing are out there in the literature, and we encourage you to spread the word and share them with your colleagues, because these are further support for these provide support for healthy beverage initiatives through other means. And the first has to do with the economic costs associated with pulling off a healthy beverage initiative. This is we've tracked UCSF's cafeteria sales, beverage sales. So this is all beverages, water and unsweetened beverages. This is all beverages before and after we implemented the Healthy Beverage Initiative. We started implementation in the summer. It was completely implemented across all of our campus venues by November of 2015. And as you can see, at least in the cafeterias, sales were pretty flat. Now, we haven't published this because from the standpoint of pulling off these environmental interventions, it's really important to bring along all vendors. There have been experiences in other institutions that in universities that have tried to take SSBs just out of the vending machines, but not out of other vendors. And the challenge there is that you will get substitution. You'll get people who find that, oh, I can't get the soda in the vending machine, but I can walk over here and get it. And so our experience so far has been that a complete sales ban is important so that you don't create perverse incentives. And that's one of the reasons that we haven't published our cafeteria sales data, because it's limited to cafeterias and not other campus venues. I mentioned at the outset all the different vendors. They all have different ordering strategies. We did try to monitor, but because we couldn't capture everything, we don't feel like this is publication worthy, but this is certainly one indication that at least our cafeterias didn't lose money on SSBs. I also, just anecdotally, we have many, many vendors, and we haven't had a lot of feedback that people are losing money. That's partly because we worked with them very closely to offer lists of 100 different kinds of beverages that are consistent with the policy that they can sell, and other strategies. I want to share with you a paper that just came out in Health Affairs. This will be disseminated to you as well, and feel free to share it with your colleagues or however you want to use this. Dr. Sanjay Basu, who is an MD, PhD economist at Harvard, worked with us to conduct a microsimulation analysis of the impact of a workplace sales ban on employee and employer health spending and productivity. And to just summarize the results of this analysis, this is not an actual direct observation of employer and employee costs or anything like that. This is a simulation analysis. So what it does is it leverages off of the results from the employee survey that Alyssa shared a little bit of the results with you at the outset, that just studied consumption changes in SSBs before and after the sales ban. We do have the benefit in our current trial with the Sutter Health System to actually track medical records, and the majority of our sample in the Sutter Health System gets their health care from Sutter. So we will have opportunities to directly observe employer spending on cardiometabolic disease and so forth. But for this is a simulation analysis. And what we found here is that the HBI over a 10-year period will save about $300,000 per 10,000 people. So this is a net cost savings approach. And I want to point out here that these estimates, Sanjay conducted a range of sensitivity analyses with different modeling approaches. But this $300,000 figure is coming out of analyses that assumed that the institution would lose all of the money associated with SSB sales. So this figure is net of SSB sales losses, with assuming no substitution, assuming that people won't go and buy juice or other beverages. And the majority of these costs came through healthcare spending, but also through productivity gains in the population. And so, as you could see from the results that Alyssa shared, if central adiposity is going down, you're looking at potential productivity gains for the employer and for employees. So an economic win. I just briefly want to share work by David Cleveland and Jenny J. David's at UC Santa Barbara and Jenny is at UCLA. This is a paper, again, that just came out, a really important and impactful paper, particularly given the comments that Alyssa made about climate and food policy and the interplay. And I encourage all of you, again, we will be sharing this through Craig and company. David and Jenny, they took a variety of innovative policies. Our president, who just retired, President Napolitano, made a policy statement at the beginning of her tenure that she wanted our campus to go carbon neutral, and by 2025. And in the interests of that, our campuses have been innovating in many, many different ways to try to turn down our greenhouse gas emissions. And David and Jenny modeled the environmental co-benefits of a whole range of different strategies, many of these that could easily be applied to health systems, things like Meatless Mondays, the Cool Food Pledge, educating people about the interplay between nutrition and human health and climate. And so I'm just going to share the results that they brought about by their estimates of environmental co-benefits for the Healthy Beverage Initiative, but their paper provides many other options for strategies that promote health and reduce greenhouse gas emissions. And so the reductions associated with the Healthy Beverage Initiative would amount to about a 2.3 estimated decrease in greenhouse gas emissions. And their estimate suggests that a lot of this has to do with the packaging associated with aluminum and plastic and the packaging of bottled beverages. So I'm gonna finish up by just talking very briefly about dissemination of this concept and the incredible, my just deep joy in seeing how this concept and food environment changes have been just become a social movement across the health sector. And one of the most exciting developments has been what's going on in the United Kingdom. The National Health Service had about a year ago, they launched a Healthy Beverage Initiative. It was very funny because one day I was sitting in my office and I got a call from the NHS, and they had heard about our Healthy Beverage Initiative, and they were very dealing with some real challenges around that issue of, is it going to make us lose money? And so I shared with them the data that I shared with you, the actual raw data, in this case on the cafeteria sales, and we talked and tried to help each other. They said, well, we're going to try to pilot this in 11 of our hospitals. A year later, somebody shared with me this article in the Telegraph showing that the CEO of the NHS basically said, no, we're not going to just do this in 11 hospitals. We're going to do it everywhere in every hospital in England. And this shows you, thinking about those metabolic and greenhouse gas emission benefits, and thinking about an institution of the scale of the NHS and what it means to do this initiative across the system. You really are looking at huge health impacts, huge benefits to the environment. Another wonderful outcropping of the work that we did at UCSF is that the University of California as a whole took it upon themselves to try to scale up as best we can the Healthy Beverage Initiative at UCSF across other campuses. This is happening through our Healthy Campus Network, which is a 10-campus system-wide initiative. The UCs are one of the largest employers in California. We have a huge health system, 6 different health systems across our campuses. We have a very large retiree population, many dependents in our health plan. And so if we feel that if we can make changes happen in the UCs, we can be a real leader for health and become a true anchor institution within our state. So Healthy Beverage Initiative has been, we received just for this, the first year, the system-wide human resources division across all of our campuses gave $1.7 million to the 10 campuses to try to begin launching healthy beverage initiatives on all 10 campuses. One of the things that we learned from our, every time you try a new idea, you learn a lot about how to do it better next time. And when we scale, we build in the learnings from each smaller effort. So the most important thing that we learned was that while we could reap some greenhouse gas emission reductions through just taking the SSBs out, we realized that if we could build free tap water stations, lead tested, attractive, socially marketed into our campus environments, we could do a lot better for sustainability. We teamed up with our colleague at Stanford, Dr. Anisha Patel, to develop, she has colleagues in the business school there, to develop a tap water rebranding campaign. So taking a page out of the marketing strategy of Coca-Cola and PepsiCo, how do you think about tap water as a branded product, branded by the UC system? And we have a really innovative social marketing campaign that we're starting to try to scale up alongside working across all 10 campuses. We're working around procurement policies, both on our campuses and system-wide. A major barrier here is that 9 of our campuses have exclusive pouring rights contracts with Coca-Cola or Pepsi. And so there's a lot to work on and learn. And we're also trying other strategies, warning labels, choice architecture. Each campus becomes a little learning, a little laboratory for learning about new strategies. We have 10 faculty members convened by our Nutrition Policy Institute, which is a UC, a gem of the UCs that was instrumental in getting SSBs out of California schools and promoting clean water in our schools, our secondary schools. And we have faculty on all 10 campuses, interdisciplinary, working together to try to pull this off. I want to just close by sharing with you some resources that we have available. If you go to sugarscience.org or sugarscience.ucsf.edu, you will find there all of the materials that we used to launch our Healthy Beverage Initiative. What we did was we packaged them in a way that they would be generic and available to anyone. So if the social marketing materials that we used are available, and you can even download table tents, and we have a commercial, a public service announcement if you have a marquee that is, and what we did was we took the materials and we made them generic so that anyone, any organization can put their own logo on it and use those materials, and they're all free and available for you on the Sugar Science website. We also developed I know that one of you had asked about policy language and model policy documents, and we have on the Sugar Science website for you a model policy. We have examples of how to write contract language for a healthy beverage initiative. We also have an implementation guide where we sat down and we kind of did backward-looking implementation analysis to try to understand where we went wrong and where we did things right. And so we share some of our struggles and challenges and how we overcame them there. And so I encourage you to reach out to us at our email addresses directly if you have any questions or opportunities to collaborate, and to go to the Sugar Science website if you would like to use any of the materials there. So with that, I think I'll
Great job, Laura. You know, there's a common theme to a lot of the questions that you might comment on, Laura, and that is how do you convince vendors and chains, and what, you know, how do you deal with resistance? And I think that, you know, the other question is how do you deal with big soda industry if they push back? That's probably a different talk, and it's probably not a public talk, but it hasn't been.
Yeah, let me first just say thank you to you both. I think just a wealth of helpful information, just not only from your experience at UCSF, but I think, Laura, as you said, trying to pay it forward, so to speak, and building the evidence base around why this type of work makes sense from a business standpoint, as well as the various co-benefits. And thank you, Alyssa, in particular, for, I think, helping us to ground us in the moment and why those things matter. So I know we're a little close to time here, but we have about 7 minutes. I know questions have been coming in. If you have additional questions, please send them through. I think Alyssa has been trying to answer things as they've been coming in. Thank you. And I think, yeah, the first one, want to pick back up, Alyssa, the point about pushback. And Laura, you mentioned avoiding the personal choice pothole. And so would really be interested in hearing from your engagement standpoint, what were some of the particular challenges, especially in trying to adopt a comprehensive approach, and what that meant in terms of getting buy-in for how you defined SSBs and the products included under that. There's a question on artificially sweetened drinks and the debate around that. So I think in terms of not just the products that fall under the policy, as well as the venues in which those products are sold, and whether cafeterias, but in particular, how to address and engage with different retail vendors.
Yeah.
So I think that it's a matter of building support, and it's with anything, momentum is you want to start with the easiest. Pick off the easiest challenges and then save the hardest for last. So we worked closely with allies. Identifying allies is really important. Yeah. And bringing in stakeholders from the institution who are passionate. So we had a couple of researchers, but also physicians, for example, surgeons that transplant livers due to non-alcoholic fatty liver disease, which is linked to sugar, excess sugar consumption. Dentists, people who really see the carnage and care a lot about it. We had passionate nursing folks. We had dentists, people who really cared a lot about this, and we would put them in front of the people who were more skeptical. I think other institutions will benefit from having publications in peer-reviewed journals that demonstrate the economic benefits, the environmental co-benefits. I think the health benefits. When you look at the health benefits, you almost have to ask the question: is it responsible for employers not to do this? But I also think, you know, we had harder and less challenging and more challenging vendors. We always led with the health message. We always said, leadership is behind this. We want you to partner with us. If you, there's some really good material out there on collective impact and stakeholder engagement techniques. We use very similar techniques to launch, help our city of San Francisco launch one of the first soda taxes in America. So it's a very generic set of skills. And we have, if people are interested, we have a paper that describes the approach we use around the soda tax, and it was nearly identical to the one we use within the university. So I think it's a matter of starting with making sure leadership is somewhat supportive, and then working down from there. Now, the experience of the NHS is really, I think, quite interesting. In that case, they had a new, passionate CEO who came in and just said, you know, this is something we're going to do. And by the way, they also took candy and confections out of their gift shops all around the hospitals. And so and that's the other thing. I think once, you know, if you think about building momentum, once you hit about 15 to 20% of stakeholders, you achieve what's called critical mass in terms of the diffusion of innovation. And then it becomes harder and harder for people to not join in. So you can start to gently almost kind of shame people a little bit. Well, you're you know, right across the way here in the food court, the Jamba Juice is taking the sugar out of everything. Everything they serve is going to be whole fruit and whole juice. So Panda Express, come on, get a, you know, and so, and that's happened within the city. So all but one hospital has now done a healthy beverage initiative. So people in competition with one another are going to, you know, be responsive to the fact that other people are changing. And why, and so it's really about getting to that point of critical mass where you can say, you know, look over there, they're doing it, why aren't you? Yeah. Or why, if the whole NHS and all of these hospitals around the country are doing it, why aren't we kind of not really protecting our brand? And so that, I think, is the strategy that tends to work most effectively. And if people want to email me, I can share we wrote a chapter in a book on this experience around the soda tax in San Francisco, and we use the identical approach here.
Yeah, and I also want to say, pointing to the data helps. So the soda industry's response to our study and those like it is that people don't like bans. People want personal choice. This will be very unpopular. And that's just not true. It's simple. Our data shows that we had tremendous compliance, no serious complaints. And the complaints that we did have were from visitors, were from people who entered our environment and culture with no preparation, no sugar science pamphlet to say, you know, this is what sugar's doing to your health, and that's why we don't serve it. So we had a very large ramp up of our social media campaign for education, and then the ban started. So for any type of institution, having the buy-in and the education first and the dialogues is critical, and then people are grateful. Our cafeteria workers used to get free soda at the tap all day long. They were our heaviest drinkers, and they are healthier, and they are grateful for the help.
The other, I mean, I think there are a couple of ways to push back at the choice issue. Lori Dorfman of the Berkeley Media Studies Group has a really, and I encourage people to visit their website, and you know, she's an expert in how to frame public health issues. And if you think about junk food and SSBs, choice is really an illusion. You might have cartoon characters and fancy marketing on the front of the package or the front of the can, but when you turn it around and you actually look at the ingredients, it's all pretty much the same. And so choice is an illusion. We have more choice under a Healthy Beverage Initiative when we have 50 different ways that you can, different kinds of tea and you know, all these different juice flavored waters and all of that. So it really, having a food environment that is just one thing on the back of the package is really not choice. But in the case of a sales ban, you're not even asking people to change their behavior. It's the choice of the institution to change their behavior. And that's why I do think something like this top-down strategy that the NHS used is a viable approach. If you can convince top leadership that this is not consistent with our mission and this is bad from a branding standpoint, then, you know, that's another way to do it.
Yeah. Well, unfortunately, I'm mindful of the time, and we are at time, and I feel like we could certainly keep going for another hour. I know there's been a lot of great questions, and it's been a really, I think, exciting and fruitful conversation. I want to once again say thank you to Laura and Alyssa for joining and sharing your experience, your expertise, and really the passion and energy that you bring to this issue. And then also thank you all who took the time to join today. I know there were a lot of questions that came in. We will take the time to answer them, and those will be included in a follow-up that goes out, as well as the various resources that were mentioned on today's call. So with that, we'll close. And once again, thank you everybody for attending. Thank you, Laura and Alyssa.
Thank you so much, Craig.
Pleasure.
Thanks, Craig. Thanks, everybody.
Bye, everyone.